Hello everybody and welcome to episode 3 in this series of podcasts on the AKT. My name is Dr. Margaret Mascarenas. I'm a GP Training Programme Director and I'm delighted to be joined today by Dr. Chris Else. Chris, how are you today?
Morning, Margaret, and thank you for inviting me back again. Looking forward to talking with you today. And I'm conscious today we're talking about a really important part of this exam preparation.
Yes, thank you, Chris. Today, our podcast is going to give you some excellent advice on how to approach the AKT if you are having to resit the exam.
We know from everyone's experience that this exam can be more challenging than at face value. What we would really like to achieve today is to give you some clear thoughts and appropriate ways forward if you're having to face sitting the exam again.
We really do want to offer our support to anybody who has to resit this exam.
Margaret, I couldn't agree more. And I think that the real challenge here is that all of us as successful doctors who've passed many exams to get to where we are at this stage in our training, and this might be the very first time in our lives that we've been deemed as unsuccessful at an exam. It's a major hurdle. It causes lots of powerful emotions. It can really feel hurtful, I guess. It can make us feel angry, frustrated, all those emotions. It's almost like a grief cycle. So how do you cope? You can't plan and resit something while you're in emotional turmoil. I think there's a need just to find an outlet for those emotions. Don't do this alone would be my feeling about this. Who have you got for immediate support? Who are you going to talk to about this? There are too many stories of people trying to keep it to themselves. Sometimes educational supervisors didn't even know that their trainee was about to sit the exam. And if you feel you can't share it with your close family, who can you share it with? Have you got a friend to turn to? If not, who in your professional circle can you start to talk about? I went to a session I'm based in Wessex, and our dean for the whole of medicine sat in front of everyone and explained how many times they'd had to take their exams before they became a successful consultant and then went on to become a dean and a national figure. And I think that's such a refreshing story. And actually, when you talk to all of us as doctors, you hear so many of us had some hurdles in professional exams.
Thank you, Chris. You're absolutely right. And I want all of our listeners to remember that you are a highly qualified professional to have already succeeded to get to this point in your career. And this podcast, I'm delighted to say, we will re-energize you and give you some fantastic tips, and we will really help you get through this exam.
Margaret, yes, and of course, then I guess the beginning steps, then, if we can contextualize that emotions and then pause, and how do we recharge a battery? What do we need to do to then start to think more logically about this? We've got to reflect on what's happened, on our feelings. We've got to start to analyze them objectively. We've got to address our motivation at this point. And what do we need to do? It's like the phrase that Nelson Mandela sadly used to have to say, being knocked down, dusting himself up, getting back again. And how do we find that inner resilience and motivation to say, okay, this is what I have to do. This is what I have to face. And before you go anywhere forwards, you need to reflect on what happened and what was in your control at the time that you feel you could look at differently, and what was perhaps outside of your control at the time. So if, for example, I was in a situation with a long commute and something happening in my close family that I'd had little control of, and that may well have had a significant impact on my preparation time. So I need to look now, where am I in my life and life around me? Am I ready to reset? And it goes back to our conversation we had last time about readiness to sit, I realise, but you need to be thinking, what is it I can control, and where am I going to start to analyse about what I can change?
Thank you. And we would encourage all of our listeners, please speak to your educational supervisor, your training program director, and also your own GP if you are struggling. We know it is a very upsetting time. We also have our professional support and wellbeing team, and also practitioner health, which is an excellent service.
Yeah, no, thank you, Margaret. And so, apart from those close to you, yes, what professional support do you need to access and be proactive about accessing? As you start, hopefully, to feel okay, I've got to relook at this. The old adage of stop, start, and carry on comes to mind. Look at what you did last time. What was your preparation like? Did you have the appropriate time? Was it protected? Good revision hours? How well planned was it? How focused was it on your needs? How much GP experience have you had? Was it something about your exam technique? Was it something about exam nerves? Is it something about a long time based on a computer? These are all things to start to contemplate, because you need to analyze how to improve your chances of success. So if something was unhelpful and ineffective last time, and as you reflect, you realize that you're thinking at the time, that was your thinking at the time, but as you look back, actually, you could do it differently. For example, if I only revised in the last 2 weeks because I didn't think the exam was such a challenge, if I didn't look at the subjects that I've had no clinical experience of, those sort of things, if I only ever looked at question banks and didn't think about it applied to my working knowledge with patients, maybe I do need to change those. What do I need to carry on doing? So if things were useful to me, going through a previous exam preparation, if you've made relevant notes, if you had some mnemonics or mind maps or revision cards or audio notes or posters on the wall, that isn't lost time. And in fact, you're in the position where you are into true revision, maybe, because you are re-looking at something you did and therefore adding to the knowledge you've started to cement together in your deeper learning, and looking at other ways to make it perhaps more memorable, or where are the gaps that you need to top up on. And what do you need to start doing that you didn't do first time round? So what do you need to do differently, do you think? And I think, like you said about with your educational supervisor or your TPD, what do they think and know about you and suggest that you might be able to do differently? You'll be the decider of that. But I think if you have had very little clinical experience in undergraduate and postgraduate years, this is now the time to say, how do I get that experience? And where do I get it? Do I have a conversation with my peers? Do I have a conversation with my ES? Do I speak to the chronic disease management nurses? Is this about me having to look up certain subjects in my own time? Do I need to do it in a revision group? Do I need to be seeing patients with certain presentations? If I've had very little child health experience, or my child health experience was limited to acute medicine only in hospital, I need to talk to my supervisor and make sure I'm having a surgery and phone calls with parents and seeing babies, seeing young children. And as I see them, thinking, where are my gaps here? How might this be tested in the exam? I need to look up this area. I need to do some questions on this part of child health as my revision.
Thank you. That's such a good idea. And I would echo that. It's certainly if I've got registrars who perhaps haven't done a post in obstetrics and gynecology, a really good place to get that learning is in general practice. So, for example, you could ask your supervisor if it's okay with them that anybody who rings reception asking for contraception, HRT, a gynecological problem, ask them to book them with you and maybe have a morning surgery where you only see women's health problems. And by seeing the patients, prescribing for the patients, that is how you will get the true deep learning of the subject.
And again, I would echo that, Margaret. And in fact, I would add to that. So I remember a trainee not too long ago who had been an MRCOG candidate, had switched to primary care. But actually, as they said to me, we didn't really do any contraception in secondary care. So even though they had lots of a specialist attachment, it didn't equate to community primary care experiences. And then I think for all of us, then how do we motivate ourselves? What is it now to keep this motivation going? Because we're having to face the challenge. It's expensive, we know that. It's time consuming, we know that. It affects our plans that we had with our family, friends, social life, or other work interest that we wanted to take. Now we've got to put hours back in to good, effective preparation for a significant postgraduate exam. So how do you create that motivation? Are you a rewards-based person, for example? So do you need to set yourself targets and have small rewards for yourself? Do you need a particular form of exercise to feel better, to get you ready? Do you need to have relaxation? Think about, again, the sports analogy we used last time. Think about your well-being, your sleep, your nutrition, your exercise, your time, your rest time. Rest your brain and enjoy your time with your family to make then your planned revision more effective and focused.
Definitely. And you mentioned planning. So if you are in a position of resitting the exam, it's a good idea to think of perhaps a different revision plan, a different way of studying, and plan that really, really early. It might be that you look at getting a peer group together in person at your VTS or online. And maybe, as we mentioned in previous podcasts, use those group sessions to be fun, but also challenge yourself on discussing topics you're less comfortable with. And if you can explain a really challenging topic to your peers, that shows you've got a good level of understanding. An acronym that I found really helpful is SMART. So when you're planning your dynamic revision sessions, make them specific, measurable, achievable, realistic, and in a timely fashion that is really something you will fit well with your work and home life. You could even ask your peers, shall we create some MCQs? Create your own questions on those tough topics. And when you're doing these group peer sessions, make sure that your enjoyment is at the forefront, but you keep an eye on time and give yourself a protected learning environment where you've got a clear structure for the end of the session whilst you're having a nice time with your peers.
Yeah, and I like that, Margaret. I think writing your own questions, they don't have to be very good in one sense. You can all argue about them with your colleagues about which is the correct answer. That doesn't matter, because actually you're trying to assess how much can I summarize a topic into a question. And I'll put a little plug in here for the use of AI, whichever AI software you like to use. Create yourself some free, easy AKT style questions. They won't be the same as in the exam, but again, it'll give you a free resource to create lots of questions in areas that you're finding difficult, just to test your knowledge. I do think we should be regarding a revision plan learning needs as dynamic, not static entities. So we do have to revisit them, not just revisit the one we had from the first sitting. We need to look at our learning needs now in our logical mode, and then a week, a month later, we need to revisit that. They're changing and shifting all the time. So be proactive about this, not reactive, which is hard to say if your motivation's low. Revisit the RCGP resources we talked about, and included in there, Margaret, I put a plug. We do have some resources about resitting the AKT, and although it might have several pages to it, I would really encourage you to sit down with your supervisor, print off perhaps the resitting the MRCGP AKT exam guidance, and look through that together. And define for yourself, with input from your supervisor, which areas are most relevant to me within that. Because that, you need to tailor what you do to yourself. For example, it may be that for me, I really didn't have much understanding about data interpretation. Even though it's only 10% of the exam, that's still a relevance if I was frustratingly close to passing. So I might need to focus on data interpretation. You might say you need to focus on a certain couple of clinical areas, or somebody else might say, well, actually, I didn't really understand the capacity and consent type questions and the administration and management. We'll all have different needs. So we need to then analyze those. They're individual, and they will change as we start to develop our understanding. And I want you to revisit a revision plan. A revision plan doesn't have to be rigid. It doesn't have to be too all-encompassing. If that's your preference, that's fine. But actually, you need to build in flexible time, because there will be some days when you simply can't revise that you plan to do so. Life will get in the way. Have a plan that is also one for the coming week or the coming day or just the session you're about to do. And when you're at the end of that session, just pause and reflect. What have I understood? What have I still not understood? Does that thinking now feed into my revision plan for tomorrow or next week?
Thank you, Chris. Could you tell us a bit more about the Royal College website in terms of the exam feedback documents that are generated?
So we know that as an individual, if we sit the exam, we get very limited individual feedback, don't we? So we'll get our score based on the 3 domains compared to the whole number of our colleagues sitting the exam. But you will see on the college website after every exam, within a couple of weeks, there'll be a detailed document summarising feedback for candidates and educators. It will summarise areas that were done perhaps slightly better than have been done in the past. That's a positive feedback message. But also it'll highlight areas that have proven more challenging than expected or are proving difficult and therefore directly relevant to any of us resitting an exam and, to be honest, sitting the exam obviously first time. So those documents are invaluable because if the college are producing those well-intentioned feedback highlighting areas that are proving difficult, we can assume that the exam will continue to test in those areas. So we must not ignore that. And if we see it, and I see, for example, it's HRT or management of COPD, doesn't matter what it is, but if I see it's in there and think, I don't know much about that, I'm really compromising my own chances if I ignore that information. So I now need to be proactive and say, yes, that is relevant to me. And they've already told me it's going to be feature in an exam in some format again. Not only is there that document, but we're conscious that, well, the exam now runs 4 times a year, so this feedback is cumulative. So there's also a summary document to save you having to go back as an individual over every exam to look at individual documents. There's a 5-year summary that collates the themes over those exams, and those themes seem quite repetitive. So have a look at those and see which of those repetitive themes would match your own learning needs. There's a link on the AKT page with the Resitting the AKT document as well. So that's got information broadly about this, but also there's a link to reflecting on if you haven't been successful yet at the exam, reflecting and what do you think you need to do differently effectively. So it's a link to reflection. And I think you'd also see there, Margaret, with this whole self-analysis, if you like, after not yet being successful, we need to think, is there anything about this that might suggest I am neurodivergent, for example? So the exam might be about something that was out of my control in my family life. It might be about my own preparation. But if I'm struggling with a computer-based test and processing that information, if there's a strong mismatch between what my educational team is saying and how I am confident clinically with my patients, and yet this seems to be very different in a computer test environment, we're advocating consider a specific learning differences screen. Have that discussion with your supervisor, TPD, whether it's the professional support team in your area or how that might be considered. And if it isn't available for whatever reason in your area, there are private services available. But consider that. And a screen is just a screen. A screen doesn't tell us everything. So there is time commitment if you're going to go through and have a further assessment. And perhaps we could talk about that in a different session.
Absolutely. Another point to make is we know it is a very busy day in the life of a GP registrar. And I would like to propose that when you are at work, use that as a learning opportunity as well. For example, we know from the wonderful document that you wrote on the college website, roughly 30% of the clinical scenarios in the exam have a therapeutic content. So when you're seeing patients, Go and review the medications they are already on. And if there's a medicine you're not familiar with, that's a good opportunity to look it up, and you will probably remember it better by associating it with the patient that you saw. In addition, using your debrief sessions with your educational and clinical supervisor is an excellent way of continuing your AKT revision in real time.
Yeah, no, thank you for bringing that up again, Margaret. I think it is really important, because we did do that analysis of several exams, and across the different clinical categories. If you think about cardiovascular, there's going to be prescribing. If you think about respiratory or gastroenterology or endocrine, keep going, dermatology, all of the psychiatry, all of the areas that feature across the clinical topic guides in the broad GP curriculum, clearly prescribing is a big part of our role. Obviously, deprescribing, not having polypharmacy, that's a really important part. So self-care is hugely important for us all, but prescribing is crucial. We know the GMC flagged up about significant prescribing errors several years ago, and of course, therefore, a national licensing assessment has to look at prescribing in detail. So I think I shared with you at a previous conversation, Margaret, about, for example, I worked with a pharmacology consultant when I was a young doctor, and it left me unable to prescribe something that I hadn't prescribed before without looking it up. And that's been a really positive thing in my career. It does slow me down at times. And still now, if I'm not sure, I have to look it up in the BNF, or the BNF online, obviously now. What are the major indications, interactions, monitoring requirements, side effects? I need to know. And if, therefore, you don't feel confident with any drug you're being asked to prescribe, please, with relevance to AKT, but safety-wise for your patients, look it up. And that will stand you proud for many of the questions that you see in an exam, let alone in your own life practice.
Thank you. So I think we've covered a really wide range of useful advice for how to approach resitting the exam. I'd like us to go to our take-home messages. Chris, what are your thoughts?
Yes, I think it's hard for me to pick one or two things. I think I would reiterate, what is the team around you like? So, what is your own ability to look after yourself when you're feeling bruised and hurt? And who is there to reach out to? Don't retreat. Look outwards. Who at home can help? There are sacrifices being made, and you need to ask your family to give you time again to revise, and that does impact on you. Be proactive with who to contact and discuss this within your educational team. Do you need a simple conversation with your supervisor? Do you need a much more in-depth conversation? So I think the team around you, and build that team to help you prepare better. I think the positive nature of this is, remember that 95% of our colleagues are successful, but that doesn't mean first time. So over time, most of us will get this exam. So that, hold on to that. There's a positive, there's a light. What's your positive outcome? Where are you going to be in 4 or 5 years? How do you therefore motivate yourself to carry on? And I think I'll finish by saying, analyze what you did before and think, what worked well? What has worked well for me before in the past with exams? Do I need to do differently? There will be something you can do differently. And I think being proactive about that stands you in good stead. If we are able to gain a better understanding across a variety of areas that we previously didn't see the need for the exam, or didn't see the relevance perhaps, that will give us a more rounded capability in our working life as a doctor. And as we look back, if we can get over that disappointment, as most of us will be successful at this exam and go on to be successful primary care physicians, having an amazing career in the NHS with all its challenges and complexities, that process and what you learnt about yourself and your own resilience and your own ability to overcome adversity when things were feeling tough, that will stand you proud through your life.
Thank you, Chris. And I would say to all of our listeners, remember your love of clinical medicine as a truly wonderful vocation, and use this as an opportunity to re-energize your passion for clinical medicine and involve all of the team around you. Make it fun, make it energizing, and we are all here to help you. This is part of the reason we're doing these podcasts. We are really wishing you all the best. We really want you to pass this exam.
And I would entirely concur with you, Margaret, and see patients. I think all of you would like to think, I can do this from a book, I can do this from my question banks. See patients, link learning to patients. Patients bring experience, patients bring interesting dilemmas and challenges, and so many of what we're doing on a day-to-day basis is what will help us be prepared for that exam.
Thank you so much, Chris. I wish all our listeners every success in their exam.
And from me, us too, at the AKT team.
Thank you.